It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelley with more IRG Health Talk.
Our next guest, Wendy Flores. She's talking about her life as a private practice counselor and working with complex trauma. What is complex trauma, Shannon?
Well, complex trauma is complex trauma that usually occurs in childhood that people take with them through their lives, their adult lives, and sometimes leads to other problems in the mental health world. And Wendy focuses on this complex trauma.
All right, here's Wendy Flores and Shannon O'Kelley.
Wendy Flores, welcome back. How are you?
I'm great.
Well, thanks for coming on again with us. We were so intrigued last time we spoke a couple months ago. You're a mental health counselor working out of the Shoreline area. And we talked about complex trauma and some of the results of complex trauma. You talked about complex trauma, how it occurs. A lot of time it's in our childhood or youth, but it can lead to some things so-called downstream, such as behavior problems, disorders, disassociation disorders, all kinds of interesting stuff. We had a chance to kind of talk about what it is. Maybe we can review that real quick, but more importantly, this time around, I want to talk about how you can help, okay?
Yes.
And the treatment, okay? Let's just review real quick complex trauma, and then let's get into the treatment, all right?
Complex trauma, leads to a host of symptoms. Just some of the highlights might be, able to function in some situations, but not in others, and overwhelming emotions, sudden, intense physical or emotional reactions. Anxiety rules your life. Some people can't stop hurting themselves, can't stop drinking and using drugs.
Yeah. And Wendy, is it fair to say this complex trauma occurs from some very significant events, usually during our formative years, which is our youth, I guess, and then kind of presents itself?
Generally when we are very young. And these are repeated events, not just single incidents. These are repeated events that are generally perpetrated by people that are supposed to be taking care of us.
That's the worst kind. So, I may think I have it. I may be experiencing some of these anxiety, personality disorders, disassociation behaviors, whatever it may be that manifests itself. I reach out to someone like, this is probably a really big job for you and the patient. I'm sure there's a lot to work through. I can just only imagine. Maybe let's talk about, how do I begin? Where do I start?
Yeah, well, the nice thing is that we finally are getting a handle on what to do with this. So starting really not very long ago, starting in 1995, some very smart people, one of them was named Bessel van der Kolk, who wrote a very popular book called The Body Keeps the Score, which a lot of people may have read, and a woman named Judith Herman started really, really looking at trauma. And Bessel was the first person to put a person in a brain scanner and found out that when we experience trauma, the frontal cortex of our brain entirely shuts down. So our memory for events is often lost, but the back of our brain, our hippocampus, our amygdala, the brainstem, those areas are totally lit up. Those areas hold the memories for the event. And so we have been able to develop therapies that don't really work with the frontal cortex. They work with the back of our brain. And so we call that bottom-up processing. In other words, talk therapy is kind of this, old-fashioned thing. You see it like in memes or whatever. You're sitting on the couch and there's the guy writing, right? But when we only talk without paying attention to what's going on in the body, we're only getting at the frontal cortex. And trauma does not live in the frontal cortex. Trauma lives in the body.
Back with Wendy Flores and Shannon O'Kelley next on Como.
It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelley.
Continuing our conversation with Wendy Flores and Shannon O'Kelley talking about complex trauma.
Wendy Flores, again, thank you for joining us. We're talking about complex trauma. Fascinating stuff. The treatment aspect. You just described that this trauma occurs. I think you mentioned the frontal cortex, but your frontal cortex doesn't remember the trauma. It's in the back of the brain. Maybe for our listeners, let's do a little neuroanatomy, frontal cortex, personality, et cetera. I mean, tell us what's going on there.
Well, the frontal cortex is basically where we have logic and reason. It's part of the brain where we sort of like think. And it's what makes us different from the other mammals walking around. But the back of our brain, that's our mammalian brain. That's the brain that we share with all of the other mammals. That brain responds just like an animal responds when there is danger.
The complex trauma then is kind of erased from the frontal cortex, so the logical stuff kind of evaporates from it or comes out of it. I'm kind of getting this a little bit. This complex trauma, you're doing a great job. I'm kind of getting it. So you get into that back of the brain therapy then.
That's right. And so when we are able to work with the mammalian brain and treat it as if, because it does think that it is still in survival mode, then we can calm it down. Then we can get some healing. And I just wanted to mention, I wanted to mention some of the names of the treatments. Okay, so there's some really famous ones by now. One of them is called Somatic Experiencing by a man who was developed by a man named Peter Levine. Another one is a very similar one called sensory motor psychotherapy. Both of these work to release stored trauma in the nervous system very gently. And then there's another one called Emdr, which a lot of people are now familiar with, which is a fascinating one because it's about moving your eyes back and forth very rapidly, which is what the therapist helps you do. And the brain is able to reprocess small bits of memory and move them from short-term memory into long-term memory. So you don't lose the memories, they just aren't constantly there anymore.
Got it. I mean, we're out of time here, Wendy. I mean, once again, it looks like we're going to have you come back in the future to update us because, we picked this topic that is complex, no pun intended, and fascinating stuff. The human brain is so amazing, and the more we learn about it and the more we learn to exercise it or treat it, mental health is a big issue right now in our world with everything we've just gone through. I'm thankful there's people like yourself, Wendy, out there helping people. So thank you.
All right.
Our thanks to Wendy Flores. You can get more information at wendyflorescounseling.com, and that might be worth checking out. We've had, the app we talked about earlier, Shannon. We talked about Alzheimer's, and we are talking about something today. And, we think about this show as all about knees and hips and joints, but there's a lot of stuff that is above the neck that we've been dealing with today, and it's a good thing.
Yeah, you can't use your knees or hips or joints if your above the neck is traumatized or is having problems focusing, et cetera, et cetera. So, yeah, it's important.
Thanks again to Wendy Flores, wendyflorescounseling.com. Back with our final segment after this time out on Como.